This will be the beginning of a series of presentations for the recognition and prevention of potential upper extremity overuse injuries and risk factors within the Western North Carolina fly fishing community. This is part one, protecting your shoulder. The series presentations will be done by Zach Crabb, Daniel Holchin, and Jordan Wright. So to begin, getting to know your shoulder. Most of us have a basic understanding of the shoulder anatomy, but to revisit it, you have your clavicle and scapula, which many of us call the shoulder blade, your humerus, which is your long bone, oftentimes referred to as the funny bone. The acromion is an area that connects between the humerus and the clavicle. And then you have the musculature that surrounds. You have the rotator cuff musculature as long as supporting musculature. So the deltoid, biceps, triceps, trapezius, pec major, minor, supraspinatus, and infraspinatus. So the motions of fly fishing. So we start with shoulder flexion. This is raising the arm up and down while keeping the shoulder in line with the body, often very similar to the overhead cast. The shoulder abduction, which is bringing the arm up and out to the side of the body, similar to side arm casting, and then shoulder external rotation, the motion of flicking the arm and pull from the outside of the body inward. This is similar to side arm and elliptical casting. Now, each of these motions are not set in their own silo. Oftentimes, fly fishers will combine the different motions when they use different types of casts. But these are your basic three motions with similar casting styles that we will be discussing today. Sources of overuse injury. So we start with some of the most common, which are rotator cuff tears. These can be small to large tears in the musculature that surrounds the shoulder. It can generally be managed with or without surgery. And the time that it will take generally varies, but is considered to be around an 8 to 12 week rehab process. And this generally will include visits to a physical therapist. Muscle strains and sprains are a little bit more common. These are overstretches or micro tears in the muscle of the shoulder, and these are generally treated pretty conservatively. Fractures are generally require surgery and a longer rehab process. Tendinitis, if you see the last four letters there, the itis, that signifies an inflammation. So this is an inflammation and micro trauma to the tendons of the shoulder, generally the biceps tendon and supraspinatus tendon. And it is a 2 to 3 week conservative rehab process. And then another inflammation process, bursitis. This is inflammation and swelling of fluid-filled sacs in the shoulder called bursae, generally treated pretty conservatively with rest and a couple other treatment options. So how can you recognize them? So we're going to go through the signs and symptoms of each of these injuries, and I'll kind of key in on the specifics that set them apart. So with a rotator cuff tear, you're looking at pain, weakness, tenderness, limited movement, unable to sleep. And here's one of the key things, a dull, deep ache. So you might find you're having trouble even performing the motion of a cast, and then you have a deep, dull ache that persists throughout the day. Muscle strain and sprain. So a lot of similar symptoms, pain at rest, swelling, bruising, redness, weakness, difficulty using the shoulder. Here, one of the big things you're going to realize is the pain at rest. There's also going to be the bruising that you can pay attention to, and the bruising is typically going to be on the muscle belly. Fractures. So fractures, swelling, bruising, intense pain that worsens with movement, and then deformity of the bone or the skin. So the deformity in the bone or the skin and the intense pain that worsens with movement are often going to be the biggest signs. You can have smaller micro fractures, but you're still going to have some pretty intense pain with movement or pressure over the injury. Tendinitis, so these are your inflammations, so you're looking for that heat and that redness to set them apart, but also swelling. You'll have pain at where the tendon inserts into the bone, and then stiffness. And then bursitis. So bursitis is similar to the tendinitis with the redness and stiffness and swelling, but you'll still have a lot of difficulty moving the shoulder, and there'll be sharp shooting pains with movement. So those are just small ways that you can tell apart the different injuries that you may be dealing with. So how can you prevent these injuries? So we're going to start with one of the most basic concepts, which is warm-ups. So generally you should be doing 20 to 30 minutes of warm-ups before fishing or other exercise routines. It's also, it's really good to incorporate those into every single time before you fish and do exercise routines. And your exercise routine should consist of shoulder exercises. So scapular strengthening, biceps and tricep strengthening, deltoid, and then rotator cuff isometric strengthening. So this is bringing an exercise such as using bands where you bring or perform a muscular action and then you hold it without moving. Stretching, we want to do 3 to 5 stretches, usually after fishing and following our exercise routines. Ice and heat should be used daily. There's no real preference over either one. General rule of thumb is heat to warm up a muscle and get it ready for activity, and ice is to relax a muscle. So 10 to 12 minutes daily for aches and pains. And then posture. Posture is very important. Proper posture in your daily life can make large changes in health and quality of life overall. And rest. And we will come back to rest here in a couple slides. So, warm-ups and stretching. For warm-ups, the goal is to get the body warmed up and increase blood flow to the musculature. The more blood flow in the musculature, the better. So start with gradual whole body motions, and then you can work into simulating actions that are similar to the casting motion. You should be practicing your casting motions before you're actually casting, just to get the muscles that need to perform that action energized in order to do it, so that you're not straining or overstretching the muscle. And then stretching. So stretching should always be done after a day of fly fishing. Allow 3 to 5 stretches for the whole body in order to relax the muscles. Wall stretches, bandage stretchers are all great examples that should be incorporated. And then many people use foam rolling, another great way to help stretch out the musculature. So these are just a couple of shoulder exercises that we'll go through today. If you see the top left corner, the very first exercise are scapular retractions. So you could be seated, not necessarily in a chair, but just seated in general. And what you're working on is, think of a hand in the middle of the spine, and you want to bring your shoulder blades back in order to touch the hand and squeeze it. This is a great way. The scapula moves very well with the shoulder. So if the scapula is not moving, then your shoulder is not moving, and vice versa. So we really want to work on strengthening the muscles around the scapula, which then helps us strengthen the muscles around the shoulders. The top right are banded rows, so you can do this with a band in the door, or if there's a machine that you use, and it builds upon the concept of the scapular retraction. So you're still retracting the scapulas, but you're also using the shoulders to pull in a resistance band. And these can be done as high rows or low rows. The two bottoms are dumbbell lifts. So if you take a look at the bottom left, he is doing abduction, so you can use as much weight as necessary, but try not to overload the shoulder. And you're just bringing that arm out to 90 degrees. You can bring it a little bit more if you have that ability. And then the bottom right is flexion. So again, simulating some of these casting motions, you're bringing the arm up into a flexion position with as much weight as you can tolerate. Ice, heat, and rest. So rest is very important as part of the program. We're going to start with ice and heat. So they're great resources to help after a long day of fly fishing or exercises. They can also help reduce pain and inflammation as well. There is no specific case for one over the other. Again, heat generally works to help prepare a muscle for work, and then ice helps to calm a muscle down. You should do this multiple times a day. We mentioned 10 to 12 minutes earlier. That's generally a good recommendation, but you should do no longer than 15 to 20 minutes. Rest is very key. Making sure to take adequate rest days in between long days of fly fishing or exercise is very important. Resting after an injury or during a suspected injury is also important. If you feel that you have an injury, rest and see if the injury goes away. If it does not, then contact the appropriate medical professional. Posture. Posture is extremely important and often neglected. So posture is important to think about not only while you're fly fishing, but also throughout your day. So some key concepts are to keep your head up, shoulders back and down, and then keep your computers at eye level. This is also with your phone. A lot of times people will find themselves looking down at their phone. Try to keep your phone at eye level so that you're not bending your head forward and flexing it down and then elevating your shoulders. You want to work on your posture every day, and one of the good things that we like to do here as physical therapists is we like to remind patients to take 10-second breaks throughout their day where they take a look and re-examine their posture, just self-reflect on it, and then make the changes that need to be made multiple times a day. Proper equipment. So this is very important. Be aware that adding weight to the fly line will increase the load and mechanical stress on the body. So the more weight on the fly line, the more that the muscles have to do in order to perform the cast. So you need to, again, this is where the warm-ups and the stretching come from, and then the exercises so that you can help build the muscles so that they can handle the added weight on the fly line. Make sure that your rod and reel are in balance so that you don't add increased stress on the body. If they're out of balance, then you're going to feel different motions and different mechanics as you begin to cast, which can cause some adverse effects on the muscles. Try to use a fly rod and reel that are as lightweight as possible for the species of fish that you're targeting. You want to make sure that, again, you're not overloading the muscles with too much weight. And then always inspect your equipment for any dysfunction before fishing. So we want to just, round out this first presentation with maintaining a healthy shoulder and healthy life. So take care of and listen to your body. Eat right. Warm-ups and cool-downs are very important. Always try to stay active. Inactivity can lead to decreases in muscle and can really affect your fly fishing. Rest when you need it. Don't be afraid to take rest breaks, but don't rest for too long. And find a healthy balance between rest and activity. And then don't push yourself. If you feel like you have an injury or if something's bothering you, then make sure you take the appropriate break and try not to push yourself too hard. Pay attention to the signs of an injury that we mentioned before, and then be a leader for the others in the fly fishing community and advocate for safety. The community will grow exponentially if there are leaders looking out for each other and helping to prevent injuries overall. So this is just a few short references for this presentation. That is the end of part 1 for protecting your shoulder. The next part in this series is going to be for protecting the elbow, and that is the second video for the series of recognition and prevention of potential upper extremity overuse injuries and risk factors within the Western North Carolina fly fishing community.